So once again, we have Dr. Julia Aronoff, who is a board-certified addiction specialist and anesthesiologist. Dr. Aronoff, one of the questions that most people ask is, when detoxing from methadone, Suboxone, Kratom, Tyneptine, if I'm pronouncing that right, pain medication, and fentanyl, how is the sedation period of between 8 and 16 hours actually long enough?
Okay, so what we do is we essentially precipitate your withdrawals. So the withdrawals are quick because we force the opiates off of the receptors and we substitute those opiates with a blocker. That precipitates acute withdrawals, which last anywhere from 3 to 7 hours in most people, and we do monitored sedation for the length of the withdrawals and a little bit longer for comfort of patient. Once we see the blood pressure and heart rate and the body activity normalize, we start cutting down the sedation and patients wake up relatively comfortably.
When the patients wake up from sedation, one of the big worries that people have is that they're going to be so sick. So we never tell anybody that they'll have no symptoms after. It's expected and realistic to think they will have some symptoms after. What are some of the medications you can give a patient, knowing that every patient is different, every case is different? What are some of the meds you can give them for some of the symptoms that can last a few days afterwards?
Okay, so first of all, we have to understand that what we do is opiate reversal, essentially at receptor level, meaning that we go through about 70% of total reversal and withdrawal process. The rest of it cannot be made faster because it's your body healing. Opiates change human body on both anatomical and physiological level, molecular level, and it takes time for body to heal. And that process can only be expedited by patient themselves. So activity, hydration, having a healthy lifestyle, but the residual symptoms can be treated. So it's common to have stomach cramping. We have medication called Bentyl that helps it a lot. We have medication for restless legs if they are having restless legs, which is called Requip. We have medication for sleep. We have medication for anxiety. We often use gabapentin for just a general discomfort. There's really medications for every symptoms you might have, but you have to realize that it's not a symptom because you're still withdrawing. It is your body trying to heal itself, and most of the symptoms are connected with hormonal system and gastrointestinal system trying to heal itself.
But it's only for a few days until it passes.
Absolutely. Every day it gets significantly better if patients stay active, hydrated, and get good night's sleep.
Perfect. Last question. We hear a lot of people complaining that what we do costs money. And of course, we try to keep it as reasonably priced as we can. We offer payment plans. We often have scholarships and grants. But people perceive that this is only something rich people do. And